How to get out of depression. If you have depression, it could be one of these reasons. Now, there can be a lot of reasons for depression, but I'm going to break it down to a few common sources that I have seen in the clients that I've worked with. You don't have good social support. It feels like nobody understands you and that you can't rely on anyone. You're guilty of certain mistakes that you've made in the past and you're unable to move on. You're lacking essential gut microbacteria, exposure to sunlight, or physical exercise. You're stuck in a place that you don't like a job or a city, and you feel unable to escape. You kind of feel helpless and you can't derive pleasure from what matters most to you. You've suffered trauma of a big loss and haven't come to terms with it. Hi, my name is Kanashni. I'm a clinical and sports psychologist and I'm here to help you improve your mental health. To keep this video short, I just want to give you a few pointers that you can use to help yourself get out of depression. Number 1, behavioral activation. This is a concept from psychology that comes from the behavioral school of thought, and it says that you need to get your body from a physically deactivated state to a physically active state, because your brain, while depressed, is low in certain neurotransmitters that help it to feel pleasure, motivation, and boost it up. One of them being dopamine. One of the things you can do to activate your body physically is to take regular cold water showers or even ice baths. This is shown to increase dopamine levels to about 250% times baseline dopamine, and it helps you feel boosted, motivated, and positive, not entirely for a long period of time, but for a short period of time, which can then create a window for you to work on more positive behaviors and a chain effect to help you eventually get out of depression. The next method is exercise. 20 to 30 minutes of exercise at least 3 to 4 times a week. Time and time again, exercise has been shown in research to be equally effective in treating depression as antidepressants. Point number 2 of getting out of depression: surround yourself with company. The tendency of people in depression is to isolate themselves, and surrounding yourself with people who can understand you, interact with you, and communicate with you helps you feel less isolation and start seeing things in a different perspective that you wouldn't see if you were just by yourself. Even if it's people you don't like so much, make sure that you surround yourself with people who you can interact with, whether friends or family, or just going outside and joining certain community activities. The social bonding factor really increases neurochemicals like oxytocin and dopamine to an extent, which helps you feel more positive and connected to the people around you. The third important point is gut health. Recent research has found a strong link between our gut health, what goes on out here, and how we feel mentally, and levels of anxiety and depression. Now, this is because of something called the gut-brain axis, and also a neurochemical called serotonin. 95% of serotonin is actually produced in our gut. So a lot of what we eat and the types of bacteria, healthy bacteria that we have in our gut, directly controls our mood and anxiety level. I had a case of somebody coming in with strange case of anxiety with no absolute trigger and a very positive mental health history. But because he suffered a very severe bacterial infection, it wiped out all his microbacteria from the gut and caused severe symptoms of anxiety and depressive tendencies. And through probiotic treatment and other healthy diets and a little bit of cognitive training, he was able to come out of this severe anxiety within just a few weeks. Here are a list of foods that are rich in fiber and work as really good probiotics and prebiotics to improve your gut bacteria. If you feel this is helping you so far, then click on the subscribe button so it tells YouTube what kind of content you like to hear, and it motivates me to make more videos like this. Number 4 is journaling. Write down your previous experiences, your emotional triggers, things you've faced in the past, things that you're facing right now, and understand your entire emotional experience. Identify different triggers. This is a powerful technique and is used as a thought diary when we engage with clients in cognitive behavioral therapy as well. When you write things down, instead of just thinking about it, it gives structure and clarity to your thoughts. It activates your brain's prefrontal cortex, which is the thinking and executive center of your brain that helps bring calm and reason. And finally, number 5, seek professional counseling to help navigate your tough situation. Talking to a mental health professional like a psychologist will help you see things in a different perspective. So I hope these quick pointers were helpful for you, and there's a lot more to come because depression is such a complex topic and we can go on discussing it from the various perspectives in psychology. If you're really struggling, do reach out for help, and if you feel you can take control of the situation, then try these different tips that we talked about. Thanks for watching, and I'll see you in the next one. Keep your mental and physical health up.